Good evening and welcome to session one of our Tuesday group studies session for CPT. We're going to introduce the steps to solve a CPC exam case study for the CPC exam. And introducing our wonderful assistant, Mr. Sandy.
Good evening, Miss Josie. Good evening, Mrs. J, Miss Eva, uh, and to our fabulous intern team. And good evening to you all coders. Welcome you all to the first session of the group study by AMCI. Myself, Sandeep, joining you from Abu Dhabi. Please forgive me for my voice. I was down with a fever for last 2 days. But you know what? There was no way I was going to allow it from stopping me attending this class. So happy coding, everyone.
Yes, happy coding. And thank you, Mr. Sandeep, for being here. We appreciate you. And also, we appreciate the coders. We're going to go on now to Miss Eva. Please come and say
Hi
hello to the
coders.
coders.
Hi coders, welcome to week one of the study group for the CPC course, and I'm so happy to be here with you guys, and I will be in the chat.
Thank you, Miss Eva. And last but not least, our curriculum director and lead instructor, Mrs. J.
Hello, how are you? Everybody good? We have a very large class today. So I'm excited. You're going to learn a lot. So let's get started, but not without introducing the interns. Take it away, Miss Josie.
Thank you. And we're going to present our new interns. I'm happy to announce this. Very excited for all of you. Miss Anubaba, you can come out and say hello.
Hi, coders. Warm welcome you all. And hi, Mrs. J, Mr. Sandeep, Miss Josie, and all the interns. I'm very glad to be here. I will see you in the chat. Bye.
We're glad to have you. Thank you. Miss Carla, you can take
Welcome,
yourself.
welcome. Excuse me. I'm sorry, Miss Josie. Welcome, all the interns. Hello to Miss Eva, Mr. Sandy, Miss J. We all ready to get ready to code? Let's get it. Let's code.
Thank you, Miss Carla. Miss Courtney.
Hello, coders. Welcome to group study. We are super excited to have you here. Group study is awesome, and I think you're all going to have a lot of aha moments tonight and learn, and we will talk with you in the chat.
Glad to have you too, Miss Courtney. Miss Dolly.
Hi coders, I'm looking forward to going through some fun scenarios and practice with you all, and I'll see you guys in the chat.
And I believe our other coders will join us next week. So we'll go ahead and move on and we'll get started. Thank you.
All right. Thank you, team. Miss Josie, Miss Eva, Mr. Sandeep. Thank you so much for that dedication. And thank you, new interns. Welcome, welcome, welcome. I love the energy. I love you guys. I really do. I have never worked with so many interns, so I'm excited. Thank you so much for coming. All right. The goals of the presentation. Number one, we're going to discuss integumentary scenarios. Number two, musculoskeletal. And number three, respiratory. Yes, in this class, in this group study, we are going to learn how to solve multiple choice case studies for the CPC exam. Case studies, in fact, at the same time, we're going to show you how to break down these large scenarios. We are going to help you not be intimidated. No way. I promise by the end of this 4-week session, you will be amazing. I know it. All right, so here are the steps. Step 1, you have to highlight your key terms. In this class, we use this method. If it's yellow, you'll use that for your diagnoses. You'll highlight in yellow. You'll use green for all procedures and pink for anything inclusive. So if you don't want to be redundant, so pink, if it's already said, put it in pink. If it's bundled, put it in pink. Number 2, document your inventory, your procedures, diagnoses, signs and symptoms. Then you select your principal diagnosis or first listed diagnosis, principal procedure. Step 3, review all guidelines. And step 4, select the code that best matches your inventory list. I'm gonna let that marinate. Highlight your key terms, yellow, green, pink. Number 2, you're going to inventory. We've been doing this in class. Write down your diagnoses, signs and symptoms, and procedures. Then select which are principal or first listed. In this case, I think first listed is more appropriate. Number 3, review guidelines. 4, select the code that best matches your inventory. Now, as we've gone through this group study, we've kind of nailed or identified some things that you don't need to highlight at all. The reason you don't need to is because you're not going to code for it. And that means that's time saved. So number 1, don't highlight things observed by the physician. Number 2, don't highlight closures such as sutures, staples, etc. And I'm saying closures. Now you will code a suture if that is the treatment. But if you're just closing the surgical site, you don't highlight it unless it's for an integumentary procedure. Number 3, hemostasis or bleed control. Number 4, drains, surgical drains. 5, don't highlight irrigation of the surgical site. Number 6, don't highlight installation and removal of clamps and trocars. These items actually open up or help the surgical site stay in place, or they help retain, or keep it open so that the surgeon can see the surgical site. Number 7, dressings. Don't highlight those, and don't highlight surgical risks. Okay. We're going to begin with the integumentary system. And here is our scenario. So Miss Josie, will you read for me? And don't forget, also too, just want to remind everybody, we now read the last sentence, then the procedures and diagnosis, then we read the scenario. All right, Miss Josie, take it away.
Thank you, Mrs. J. Okay, I'm going to read the answers first. What CPT and ICD-10 CM codes are reported? A, 17311 C44.311. B, 17311 C44.321. C, 17311 17312 C44.391. D, 17311 17312 C44.341. Preoperative diagnosis, basal cell carcinoma. Postoperative diagnosis, the same. Operation, Mohs micrographic surgery. Indications, the patient has a biopsy-proven basal cell carcinoma on the nasal tip measuring 8 by 7 millimeters. Due to its location, Mohs surgery is indicated. Mohs surgical procedure was explained, including other therapeutic options and the inherent risks of bleeding, scar formation, reaction to local anesthesia, cosmetic deformity, reoccurrence, infection, and nerve damage. Informed consent was obtained and the patient underwent fresh tissue Mohs surgery as follows. Stage 1. The site of the skin cancer was identified concurrently by both the patient and the doctor and marked with a surgical pen. The margins of the excision were delineated with the marking pen. The patient was placed supine on the operating table. The area identified for excision was cleaned, drepped, and infiltrated with 1% lidocaine with epinephrine, 1 to 100,000. The area of the tumor and margins were marked for excision. Additional soft tissue markings were created to keep the specimen oriented with the excision site. Hemostasis was obtained by electrocautery. A pressure dressing was placed. The tissue was divided into 2 tissue blocks, which were mapped and sent to the technician for frozen sectioning. The surgeon examined the tissue, and no microscopic tumor was found persisting in the tumor margins on the tissue blocks. Following surgery, the defect measured 10 by 13 millimeters to the subcutaneous tissue. Closure will be done by the Dr. Hill from Plastics with a burrow graft. Condition at termination of therapy, carcinoma was removed. Pathology is on file. Again, what CPT and ICD-10 CM codes are reported, coders. We'll give you another minute because most of you guys have them already done.
All righty, you all are rocking. So far, everybody got it correct, and I don't even have to go through this, right? Maybe not, but I don't know if everyone answered. So let's go ahead and let's do it. First of all, here are my keywords. You see yellow. I said yellow are your diagnoses. Basal cell carcinoma. The postoperative diagnosis is the same. The procedure, Mohs micrographic surgery. Basal cell carcinoma of the nasal tip measuring 8 by 7 millimeters. Stage 1, patient placed supine. For excision was clean, draped, and infiltrated with 1% lidocaine and epinephrine. 2 tissue blocks mapped, sent to the technician for sectioning. The surgeon examined the tissue. No microscopic tumor. Defect measured 10 by 13 millimeters due to the subcutaneous tissue, and closure will be done by Dr. Hill from Plastics with a Burroughs graft. All right, so let's just quickly turn our attention to Mohs micrographic surgery of the nasal tip. Well, in Mohs micrographic surgery, we know that the doctor is the surgeon and the pathologist. So we're not going to code additionally for the pathologist or pathology. It's all bundled in that one code. Just thought I would let you know that. Also, we code stages. So essentially, the surgeon's going to remove the visible portion of the tumor. And in our case, we only had 1 stage and we only had 2 tissue blocks. After the surgeon took this stage or slice, the first slice, he cut it up into 2 tissue blocks and placed it under the microscope and determined that no more was needed, right? I know my image doesn't say that, but we only had one stage. So we're going to go ahead and solve this. At the top right, I placed my formula on how to solve a scenario. We've already highlighted our key terms. Next, we have to document or inventory your procedures, diagnoses, and then determine which are principles. So right here, my procedure. And I kind of recommend start with a procedure because this is CPT coding, and that's what we do, right? So we had Mohs micrographic surgery. Also, we only had one stage with 2 tissue blocks. And then finally, the diagnosis, basal cell carcinoma of the nose. All right, so next, let's determine, which is primary. All right, so our primary diagnosis, we only have one, basal cell carcinoma of the nose, and our primary procedure is Mohs micrographic surgery. That's fair enough. And let's review any guidelines if we have them. There are no guidelines. Now, let's go ahead and look up our code. We're going to look up our ICD-10-CM code. This is basal cell carcinoma. And if you look at your codes, look at A. You have C4431 subcategory, B, C4432 category, C, C44.39 category, and D is the same as 1. So if you look at your categories below, C4431 is the basal cell carcinoma category. C4432 is the squamous cell carcinoma category, and C44.39 is other specified malignant neoplasm of the skin category. So we know anything that's dealing with C44.32 category and C44.39, those are wrong. And C44.311 is correct. So we're going to get rid of B and C. And that leaves us with A and D. And then we have to look at it and say, well, what is the difference between the two? The difference is that D is coding for 17312. Now, what is that? Because we know that we only have one stage with 2 blocks. So let's go to our code. Both A and D share 17311. And 17311 has to be correct because they're both sharing it. But if you read it, it says this is Mohs micrographic technique for head, neck, hands, feet. This is our code. It also says that this will cover the first stage or one stage, and it bundles up to 5 tissue blocks. So we only are coding for 2 tissue blocks. So this one code should do the trick. And if you look below at 17312, this is coding for each additional stage. We only have one stage. We don't need 17312. So D is incorrect and A is our answer. All right, so I'm going to go to the chat and see how you're doing. And now I'm going to hand it over to Mr. Sandeep. All right, Mr. Sandeep.
Hi, coders. I'm going to read.
Thank you, Mrs. J. So, coders, you did an amazing job in the last scenario. Please put your questions in the chats if you're having any doubt. I don't think you will be having any doubt because Mrs. J explained them superbly. Now, this is the second scenario. I would like to ask Miss Josie to read out this scenario for me. Miss Josie, can you please do the honor?
I'd be happy to. Yes. Thank you. Okay. What are the CPT and ICD-10 CM codes are reported? A, 11471, RT 12031, L73.2. B, 11451, modifier RT L73.2. C, 11462, modifier RT 12031, L73.2. D, 11450, modifier RT, L73.2. Chief complaint. The patient is a 42-year-old female with infected right axillary hidradenitis. Procedure note. The patient, with the patient in supine position and under general anesthesia, the right axilla was prepped and draped in the usual sterile fashion. A skin incision was made in the axilla to excise most of the hidradenitis tracts. The incision was carried down through the subcutaneous tissue. The underlying subcutaneous tissue was excised. Bleeding points were controlled by means of electrocautery. The subcutaneous tissues were closed in intermediate layers with a suture of 2.0 Vicryl. The skin edges were stapled together and a dry, sterile dressing was applied. The patient tolerated the procedure well. What are the CPT and ICD-10 CM codes are reported? Coders will give you 2 minutes. Okay, coders, that was time.
Thank you, Ms. Josie. Coders, once again, I can see the chats. You guys are rocking it. And now let's go and solve this scenario. The first step is, of course, highlighting the keywords. You can see here the 42-year-old female with infected right axillary hidradenitis. Patient was placed in a supine position. A general anesthesia was given. Right axilla was prepped and draped. A skin incision was made in the axilla to excise the hidradenitis tract. Incision was carried down through the subcutaneous tissue and it was excised. Subcutaneous tissue were closed in intermediate layers. A suture of 2-0 Vicryl was used. The skin edges were stapled together and dry sterile dressing was applied. Now, if you remember our highlighting guidelines, things observed, we won't be highlighting the things observed by the physician. Closures such as sutures, staples, etc. Hemostasis such as like bleed control, drains, irrigation of the surgical site, installation and removal of the clamps and trocars, dressings, and surgical risk. Well, here accidentally we have like highlighted some of these things which were not supposed to be here. So I'll be removing. Here we go. The dressing of the the dry sterile dressing. We will be removing the skin edges were stable together. So these were not supposed to be here in this like these were not supposed to be highlighted in this scenario. So I have removed them. Let's move forward, and this is what axillary hidradenitis suppurativa will look like. It's a skin condition that presents with the formation of an abscess under the skin. It can be present in the armpits, it can be present under the breast, groin. So based on the different locations, we also have got separate CPTs for removal of these hidradenitis suppurativa. And symptoms of each stage of hidradenitis, you can see in the stage 1 it will be it will start off with the itching or discomfort. There will be a skin swelling, a burning sensation, excessive sweating. And in the stage 2 there will be single or multiple recurring lumps. The lumps might appear like more than one area of the skin. It will be larger than those were in the stage 1, and it might open up and causing the fluid and pus to drain from the abscess. And in the stage 3, widespread lumps will occur in multiple areas of the body, and there will be chronic pain, bursting abscess, difficulty with movement. So these are the stages and the symptoms of hidradenitis suppurativa. And here we go. In our scenario, the female 25-year-old with hidradenitis suppurativa in the right axilla, and total excision of axillary skin was done, and healing by the primary intention. Wound was was left for healing by primary intention. Okay, coders, now let's go ahead and solve the scenario. We have already highlighted the key terms. Now second step will be documenting our inventory procedure as well as diagnosis inventory. So let's look into the procedure inventory. What has the doctor done in our scenario? Excision of a right axillary hidradenitis was performed, and an intermediate repair was as well performed. In the diagnosis inventory, we are having an infected right axillary hidradenitis. So our principal procedure will be excision of right axillary hidradenitis, and the diagnosis will be infected right axillary hidradenitis. Principal diagnosis will be infected right axillary hidradenitis. To pick up the ICD, we'll be going to the index and we'll be searching for hidradenitis. And you can see highlighted in the yellow, it will be showing leading us to L73.2. And L73.2, here we go, hidradenitis suppurativa. That's how we picked up the ICD. Now let's take the correct answer from the possible four options. First, let's look into the option A. Before this, as I said earlier, the hidradenitis might be present in different location, and we got separate CPT procedures for the excision of these hidradenitis based on their locations. So these are the CPTs. You can see one is available in the axillary excision of the hidradenitis in the axillary location. Next, you can see excision of the hidradenitis on the inguinal region, and you can also see 11470 for the excision of the hidradenitis on the perianal or umbilical region as well. In our procedure inventory, we are having excision of hidradenitis in the axillary location, and an intermediate repair was performed. Okay, let's look into option A first. I will eliminate option A. How? It is coding for 11471. Let's look into the code language for 11471. It is coding for excision of skin and subcutaneous tissue for hidradenitis, and the location is perineal, or umbilical with a complex repair. Let's cross check with our procedure inventory. The location is incorrect in the first place. We are having a excision of hidradenitis in the axillary axilla as well as an intermediate repair. Well, it doesn't matches our procedure inventory at all, because 11471 is coding for excision of hidradenitis suppurativa in the perineal, and umbilical region with a complex repair. So that eliminates option A. Now let's look into option B, that is coding for 11451. Let's look into the code language. It is excision of skin subcutaneous tissue for hidradenitis axilla with complex repair. Well, we got the first portion correct. It is coding for excision of hidradenitis in the axilla, but the second part, it is with a complex repair. Cross-checking with the procedure inventory. Once again, we are having excision of hidradenitis, which is performed in the axilla, but it was an intermediate repair in our scenario, not a complex repair. That eliminates option B as well. Now let's look into the option C, 11462 RT, and the code language is excision of skin and subcutaneous tissue for hidradenitis in the inguinal region with simple or intermediate repair. Once again, it doesn't match us with our procedure inventory. The hidradenitis excision in 11462 was done in the inguinal region. That eliminates option C as well. And the correct option answer will be 11450 RT L73.2. And let's look into the code language. 11450, it is coding for excision of skin and subcutaneous tissue for hidradenitis axillary with simple or intermediate repair. And here we go. Option D is the correct one. So always coder, remember to select the code that best matches your inventory. Now let's move on. You can put your questions in the chat. I'll be looking through them. So coders, let's move on to the next scenario, and I would ask help of Miss Eva. Miss Eva, can you please read out this scenario for me?
Sure thing, Mr. Sandeep. Okay,
Thank you.
coders. No problem. What CPT and ICD-10-CM codes are reported? A, 19301 RT and 63.13. B, 19302 RT and 63.13. C, 19300 RT and 63.13. And D, 19303 RT and 63.13. Case 3. Preoperative diagnosis: right breast mass, lower outer quadrant. Postoperative diagnosis: the same. Procedure: right breast lumpectomy. Anesthesia: a 1% lidocaine with epinephrine mixed 1:1 with 0.5% marcaine along with IV sedation. Indications: the patient is a 23-year-old female who recently noted a right breast mass, lower outer quadrant. This has grown somewhat in size, and we decided it should be excised. Findings at the time of operation: this appears to be a fibroadenoma. Procedure: the patient was first identified in the holding area and the surgical site was reconfirmed and marked. Informed consent was obtained. She was then brought back to the operating room where she was placed on the operating room table in supine position. Both arms were placed comfortably up to approximately 85 degrees. All pressure points were well padded. A timeout was performed. The right breast was prepped and draped in the usual fashion. I anesthetized the area in question with the mixture noted above. This mass was at the areolar border at approximately the outer central to lower outer quadrant. I made a circumareolar incision on the outer aspect of the areola. This was carried down through the skin, subcutaneous tissue, and a small amount of breast tissue. I was able to easily dissect down to the mass itself. Once I was there, I placed a figure of 8 2/0 silk stitchers for traction. I carefully dissected this mass out from the surrounding tissue, along with a margin of healthy breast tissue. Once it was removed from the field, the traction suture was removed and the mass was sent in formalin to pathology. The wound was then inspected for hemostasis, which was achieved with electrocautery. I then reapproximated the deep breast tissue with interrupted 3/0 bicral sutures and another 3-0 microsuture in the superficial breast tissue. The skin was then closed in a layered fashion using interrupted 4-0 monocryl deep dermal sutures, followed by a running 4-0 monocryl subcuticular suture. Benzoin, Steri-strips, and dry sterile pressure were applied. The patient tolerated the procedure well and was taken back to the short stay area in good condition. What CPT and ICD-10 codes are reported. Coders, you have 2 minutes. Coders, time is up. Mr. Sandeep?
Thanks a lot, Miss Eva. I would have really struggled to read out this scenario. It's a lengthy scenario to read. Thanks a lot for that. And coders, I can see a lot of correct answers. The chat is raining with the correct answers, and it's amazing. And if you have got this one wrong, it is going to be a good teachable moment. So never give up, and let's go ahead and solve this scenario. So coders, so first step is always highlighting the key words. Let's go and highlight the keywords in our scenario. The preoperative and postoperative diagnosis both are the same, and we will always pick up the postoperative diagnosis because it is what the doctor have diagnosed after the procedure. So he has confirmed that. So our postoperative diagnosis will be right breast mass of lower outer quadrant, and the procedure performed is a right breast lumpectomy. Patient was placed in a supine position. He was anesthetized. A circumareolar incision on outer aspect of the areola was done and was carried out down through the skin, subcutaneous, and a small amount of breast tissue. Doctor carefully dissected out the mass from the surrounding tissue, and it was closed in layered fashion. Okay, now let's move on to the second step, that is having our inventory, the procedure inventory, and the diagnosis inventory. In the procedure inventory, we are having a right breast lumpectomy, a layered closure. Since a layered closure is inclusive in the lumpectomy procedure, we won't be coding them separately. So we'll cancel out that. And let's look into the diagnosis inventory. A right breast mass, lower outer quadrant was diagnosed, as you can see. Okay, now let's look into the option B first, 19300 RT. What does it codes for? Let's look into the code language. 19300, the code language is mastectomy for gynecomastia. well, our patient didn't had any gynecomastia. In our diagnosis inventory, it was a right breast mass, lower outer quadrant. It was not for the lumpectomy procedure was not performed for a gynecomastia. Well, that cancel out option B. Here we go. And let's look at the option C, 19303 RT. Let's now go ahead and look into the code language. It is coding for mastectomy, simple, complete. Well, this won't be also a correct answer because in 193.003, the physician or the surgeon, he will be removing the entire breast, nipples, and the skin surrounding the nipple. You can see it is a complete mastectomy complete. Well, we don't have a complete mastectomy in our procedure. Doctor has just removed a lump from the breast. So 193.03 will be also incorrect. So we will be canceling option C, and now the remaining two options are 193.02 and 193.01. Let's look into option um, let's look into option A first. 193.02, it is coding for mastectomy partial with axillary lymphadenectomy, while 193.01 is coding for mastectomy partial. Uh, we can see in the example they have mentioned lumpectomy, tylectomy, quadrantectomy, and segmentectomy. Well, the difference between these two options you can see in the diagram or the image which I have shown. You can see the answer 19301 in the first the upper one, the B, which is mentioned like B. You can see what happening in this 19301 procedure. Doctor will be removing the mass or the lump which is in the breast. He will be just excising them out. Well, in this diagram C, you can see what is happening. That is 19302. He will be removing the lump, that is right breast mass or whatever it may be. He will be removing the mass along with the lymph, axillary lymph. So he will be removing both part. So in our scenario, axillary lymphadenectomy was not performed. It was just a lump in the right breast which was removed. So we can eliminate option A, 19302, and our correct answer will be option D, 19301 RT. And once again, select the code that best matches your inventory. So coders, how are you feeling after those last three scenarios? Please put your like how do you feel? Please put in the chat so that we can see them. We can help you out. In meanwhile, yes, I feel better. I feel good. Okay, thank you. So
Mr.
thank you.
Sandeep,
Yes,
Mr. Sandeep, hi. We need to clarify something. The correct answer is 19301 modifier RT N63.13. On one slide it was A and this one it was D. So if you picked 19301 modifier RT, it is correct.
oh, I'm sorry. I'm absolutely sorry on that one. I'm sorry, Miss Josie.
Okay, thank you so much.
Okay, so coders, let's move on to the next scenario. Miss Eva, once again, can you please help me out in this in reading out this case?
Sure, Mr. Sandeep. Okay, coders, here we go. What CPT and ICD-10-CM codes are reported? A, 13101, 11403, modifier 51, D23.5. B, 11400, 11403, modifier 51, D23.5. C, 13101, 12032, modifier 51, D23.5. D, 13101, 11603, modifier 51, D23.5. Case 7. Preoperative diagnosis, large dysplastic nevus, right chest. Postoperative diagnosis, the same. Procedure performed. Excision dysplastic nevus, right chest with diameter of 1.2 centimeters and 0.5 centimeters margins on each side and complex repair of 4.0 centimeters wound. Anesthesia. Local using 20 cc of 1% lidocaine with epinephrine. Complications, none. Estimated blood loss, less than 2 cc's. Specimens, dysplastic nevus, right chest with suture at superior tip, 12 o'clock for permanent pathology. Indications for surgery. The patient is a 49-year-old white woman with a dysplastic nevus of her right chest, which I marked for elliptical excision in the relaxed skin tension lines of her chest with gross normal margins of around 0.5 centimeters. I drew my chest guess at the resultant scar. I drew my best guess at the resultant scar, and she observed these markings well, and we proceeded. Description of procedure. We started with the patient supine. The area has been infiltrated with local anesthetic, the chest prep and drape in sterile fashion. I excised the dysplastic nevus as drawn into the subcutaneous fat. Hemostasis was achieved using the Bobby cautery. To optimize the primary repair, extensive undermining was done to pull wound edges together, and retention sutures were used to keep it closed. This constituted a very complex repair technique due to skin tension. The wound was closed in layers using 4.0 monocryl and 5.0 proline. A loop magnification was used. The patient tolerated the procedure well. Addendum. Pathology report confirms it is benign. What CPT and ICD-10 CM codes are reported? Coders, you have 2 minutes. Coders, time is up. Mr. Sandeep.
Thank you, Miss Eva, once again. Okay, let me look into the chats. Okay. Okay, coders, let's move on and solve this scenario. The first step is highlighting the keywords. Let's highlight the keywords in our scenario. In this scenario, we are having a post-operative diagnosis of large dysplastic nevus of right chest. The procedure performed is an excision of dysplastic nevus of right chest with a diameter of 1.2 centimeter and 0.5 centimeter margins on each side. And in the description of procedure, we are having like patient was placed in a supine position. I'm sorry for the on clicks are wrong. we are also having a complex repair of 4 centimeter performed along with the excision. The anesthesia was used, a local anesthesia was used. The patient was placed in a supine position, and a primary repair was performed. Later on, I'm sorry, because on clicks was all went wrong. I'm sorry for that. The patient was placed in a supine position. An excision of the dysplastic nevus was performed, and a primary repair was done. And it was later on. We have lots of like. I'm sorry. I'm absolutely sorry on this one. And to optimize the primary repair, extensive undermining was also performed. And finally, it was constituted as a complex repair. And in the pathology report, it was confirmed that the nevus was benign. So this is our procedure inventory. We are having an excision of a dysplastic nevus of right chest performed of a length of 1.2 centimeter and 0.5 centimeters on each side. So total excision size will be 2.2 centimeters. That is 1.2 centimeter diameter dysplastic nevus plus 0.5 plus 0.5 centimeter margins on each side. So that will be 1 centimeter margin along with the diameter of 1.2 centimeters. So total excision size will be 2.2 centimeter, and a complex repair was also performed, which is around 4 centimeter length. And in diagnosis inventory, we are having large dysplastic nevus of right chest. So coders, I want to address one issue here. Actually, the code options has been changed, like it has been mixed as of the last slide. So once again, please forgive me for this. Now let's go ahead and solve the scenario. For this case, I would like to bring up a guideline from our MCG manual. You would have learned that excision of a malignant lesion, it will be coding with a code series of starting with 116 series, and an excision of benign lesion, it will be starting with the code series of 114 series. So in our scenario, a large dysplastic nevus was excised and it was sent to the pathology, and the pathology report did came back and it was confirmed as benign. So it is not malignant. So we are coding for benign lesion. So anything which starts with the code series of 11600, we can 116, we can eliminate them straight away on site. So in our case, we are having in option, like I'm not specifying the option, we are having a code 11603 here in the slide. It is in option D. So we can eliminate that straight away because it is coding for malignant lesion excision. Now let's look into another next option, which is 11301 and 1200. And these are our code option. Let's look what the code language for 11200. It is coding for removal of skin tags. Cross-checking with our procedure and diagnostic inventory, it was not the skin tag which is removed. It was a dysplastic nevus. So that won't be the correct answer as well. So we will eliminate that. And the remaining two options, let's look what one option A 12032 11403 is coding for. If you look into the code language for 12032, it is coding for repair intermediate of wounds of scalp, axilla, trunk, or extremities 2.6 to 7.5 centimeter. It's an intermediate repair. We had a complex repair in our scenario, so that won't be the correct. And let's look into the second option, 1301, 13101 and 11403. Let's look into 13101, what it is coding for: repair complex of trunk, and the centimeter will be 2.6 centimeter to a 7.5 centimeter, and that exactly matches our procedure inventory. It was a complex repair performed. And let's look into the second code, that is 11403. 11403 is coding for excision of benign lesion, including the margin except skin tags, trunk, arms, or legs, and excised diameter will be 2.123 centimeter. We had a total excision centimeter like size of around 2.2 centimeter. So 114303 exactly matches the procedure inventory, and the correct answer will be, I won't specify once again the options. The correct answer, if you have got this CPT correct, you are on the right path. The correct answer will be 13101 11403 51 modifier D23.5. I know there might be some confusion in this scenario because the slides were all over. If you have any doubt, you can shoot it in the chat. I'll be waiting for your questions. I know the code language. I didn't realize it is malignancy. Yes, that was one of the key thing in our scenario. Do you have any questions, coders? I don't see any questions. Okay, so that's it from my side. Mrs. J, back to you.